pressure, cholesterol, in the same way as you would, if you were a diabetic. So that's the importance of pre-diabetes. At this stage also, our heart disease risk starts going up. So therefore, we have to pay attention to that. Secondly, a lot of these pre-diabetics, maybe half of them, or maybe more, some data suggests more, become diabetics. So you can prevent diabetes by intervening at this stage. So if in a health check or a routine check, you went for surgery, you had a blood sugar test done, it was okay, doctor said it's borderline, don't ignore it. If you don't have to take medicine for diabetes, that's good, but it doesn't mean you're not at risk. So you should make sure your other stuff, your cholesterol, your blood pressure, other things are looked after, and make sure that you don't progress to diabetes. And that you can do usually by lifestyle measures and some medication if required. So pre-diabetes is very important for us doctors, and especially those of us who work now mostly in large hospitals which do health checks. It's very important to pick up these pre-diabetics and actually protect them, prevent them from becoming frankly diabetic and or getting into heart problems. What is the traditional understanding for endocrinologists? You're normal, you're pre-diabetic, and you're diabetic. That's how it goes. Okay? And I told you you could have a problem with the fasting sugar, which could be between 100 and 125, or you could have, your post-glucose sugar, which could be between 140 and 200. That is pre-diabetes. There is another type of diabetes, and the common diabetes you talk about, that is type 2. Most adults have type 2 diabetic. Exceptions are there, but 99% of adults with diabetes will have type 2 diabetes, which is adult onset, the second one, non-insulin dependent, often can be managed with diet and lifestyle and tablets. And there is both deficiency of insulin, that means your pancreas is not making enough insulin, and there is a deficiency in insulin action. So एक तो insulin कम है और जो बन रहा है वो पूरा काम नहीं कर पा रहा. So the gates are locked for insulin to act on your cells. So this is type 2 diabetes. Type 1 diabetes, that is childhood diabetes. That happens, it's much rarer than type 2. But you hear of children getting diabetes and suddenly, getting very sick. That is type 1 diabetes, where the pancreas just packs up. No insulin, shut off. So you need insulin, otherwise you're gone. With insulin, these children have a good life. But